Well, good evening, everyone. This is Dr. Ellithorpe here at Tustin Longevity Center. We meet every Tuesday at 6 o'clock until 7 o'clock. Here we let you ask anything you want to ask medically. This is a question and answer. I'll give you the best answer I have with my 45 years of practicing medicine. I've been doing the functional, alternative, natural hormone, anti-aging lifestyle, all my medical practice, and standing on the shoulder of so many greats before me, teaching the very things that are, making the rounds again, like various antioxidants, methylene blue, CoQ10, resveratrol, sulforaphanes, even peptide therapies. So all these things had their moments in the past, and we're just so glad to see the growth in the body of knowledge. I just want to acknowledge that all these wonderful people before us, including my own dad in food research, help set me on my path so that I just give thanks to the Lord for the wonderful movements in health and restoration of a healthy lifestyle. So if I don't have an answer, I'll try and take the information down and maybe address it next time we meet. We have, we're not trying to practice medicine over the YouTube. These are for educational purposes. It'd be like my impression how I would begin to approach an area of concern in natural health in the standard of care of medicine with our Western medical training. So you can ask anything you want. We have these email questions that we put out. You can get a hold of us on the email by going to our website, tlcdoctors.com, tlcdoctors.com. And there you can get on our list, and then we'll notify you once a week that we're going to be doing this live question and answer. The other way that you can do that is by getting onto our chat here on YouTube, and you can type in a chat question, and I will tend to go to the live questions first, and then I'll go to my email questions. And I hope everyone had a wonderful Father's Day last Sunday, 2 days ago. We're so thankful for all the men in our lives, and certainly God the Father. We just want to praise the men in our lives and thank them for all that they've done. And our sons who have become fathers, what a wonderful thing it is. And our sons who will become fathers, what an exciting thing. Our grandsons. So let's begin by asking some of these email questions, and we'll see if some live questions start. The first question comes from Marilyn. And Marilyn says, I know how important good, clean water is to you. Are you aware that the Trump administration is planning to repeal limits on forever chemicals that end up in our drinking water? This would end the Biden era restrictions on 4 toxic forever PFAS compounds, polyfluorinated, I think, I don't know what PFAS is, but I know they're fluoroquinone-based, chemicals that we use a lot, like on pans, nonstick pans and stuff. So these forever chemicals should be closely monitored and watched. I was not aware that these limitations on using these forever chemicals are going to be repealed. So if you have a source on that, Marilyn, or if you can type that in, I don't know if you're watching right now, but I've been doing EDTA chelation therapy, and I have been around EDTA chelation therapy since I was about 6 years old. I saw my grandfather in the 1950s get chelation to save his life because he had what is called unstable angina, or he would get chest pain while at rest, just sitting in his chair. And the only thing they had back then was sublingual nitroglycerin. And it was very frightening to see him reach for his little jar and take a tablet. And so my father, being in food research and very pro open-minded, looking at safe alternatives outside of the box, learned about EDTA chelation in the Great Lakes Academy for the Advancement of Medicine, and had Grandpa chelated. And of course, he did extremely well. After he got chelation, he lived a normal life and was able to live long enough until I had gone to medical school. So what a change that was. But they don't teach about EDTA chelation. We have cardiologists that are underinformed. We have internal medicine doctors and family practitioners that are underinformed. And they don't even know that many of the wonderful things they're trying to do to help their patient could be greatly advanced with a simple thing called inexpensive EDTA chelation, pulling out heavy metal toxins. So these forever chemicals, many of which are in our environment, they've been released because of the industrialized revolution since the 1700s. And this has put on the top layer of all of the dust and sand and atop the water that has fallen down to the silt, about a 4 centimeter level of heavy metals, and these chemicals are endocrine disruptors, like forever chemicals, like the fluoroquinones. And the EDTA chelation is so capable of pulling out these heavy metals. I've seen it over 45 years of my practicing medicine, and I've seen it since I was 6 years old, or for the past 67 years of my life. I have seen it because I was 6 when I first learned about it. So for another 67 years, I've actually watched it work. I've taken chelation therapy. I think it has improved my longevity and improved my circulation, my microcirculation. I've probably had 300 IVs since I was 16 years old. So I'm very thankful, and my mind will always hopefully stay open to learning new things. But I certainly hope that these forever chemicals will not be released. So I would like more information on that, Marilyn. The next question is from Vivian. And Vivian says, my sister's caregiver for my 92-year-old mother, or my sister caregiver for my 92-year-old mother, I guess her sister is helping her 92-year-old mother, said to prevent a heart attack or stroke, they will put in a Watchman to reduce the amount of blood thinners she's on. Then we'll do intensive dental crown work on 6 teeth, because the teeth deterioration, something about harming her bridge. I guess she has a bridge. I think the risk outweighs the benefits. Heart has a faulty valve, but no heart attack. All right, so that's a statement, but it doesn't really have a question. I believe the Watchman is trying to use a device that they would usually put in through the femoral artery that's involved in a valve repair, if I'm correct. And that valvular support will certainly help reduce turbulence in the flow of the blood from the heart at the valves, which tends to produce blood clots. So I don't know exactly who you're talking about. Most of my patients are remarkably healthy into their 70s, 80s, and 90s, and they really biologically don't have the age that their chronological age would declare. So maybe the 60-year-old here is really the new 45-year-old, and the 70-year-old here is the new 55-year-old. And that, with all the wonderful natural hormones, the EDTA chelation to improve microcirculation and pulling out oxidative damaging heavy metal toxins, along with that infusion provides tremendous vitamin C. I believe almost all Americans are subclinically having episodes of scurvy, uh, localized scurvy. So we may not have such bad vitamin C levels that we have bleeding teeth and teeth that are falling out from it, but we're subclinically tolerating such low ingestion of vitamin C, we're winding up with endothelial and vascular micro damage. And that because without enough vitamin C, we can't repair tissues and collagen and elastin, and the vasculature becomes weak. That's how you get weak tissues, and you sag, and your intestine develops bulges called diverticula, and you can get aneurysms, and all these various things develop when you don't make collagen elastin with the vitamin C and enough minerals. So we really need to rethink our medical education for our medical students, and we really need to rethink what a doctor's role and job is, and how we pay them. The insurance system, in my opinion, is a mafia uh, uh, middleman uh, organization that has not done anything but destroy the wonderful relationship a doctor has with their patient. So that's my thought on those devices and the need for the Watchman. I think your 92-year-old mother may actually do quite well if she's been a patient here, but I don't have a last name to know which of my 90-year-olds she's talking about. All right, some of the questions starting to come in live. We have Alec saying, can you explain cell calcification and what causes it? I know of so many women having to undergo stereotactic biopsies after mammograms have shown calcifications. Yeah, it is part of the post-trauma or tissue response to injury. Whenever a cell gets a tear in it, a bruise, your body has many of these things happening all the time. And very often a woman's breast during breastfeeding, during sexual relationships with her spouse, create micro traumas to the breast. These tiny micro traumas from the suckling baby or during sexual intercourse will generate, and of course, women are becoming more athletic these days, and there is this shaking, and the ligaments, they're called Cooper's ligaments, that are trying to hold up the glandular breast tissue. When that trauma of a run and this shaking occurs, we get this micro injury, micro tear. And then the healing response is triggered by a disrupted cell membrane, much like this picture here that I have. It doesn't take much to injure a cell, to take a chunk out of it like that. And so it could be just breastfeeding. It could be the trauma of an athletic lifestyle. It could be lying on your breast for hours on the one side with a poor blood supply for an hour or two to a part of your breast area. And these little fragments that you see that break away from the cell membrane act as a secondary role to be what we call cytokines, and they call out, or so to say, send chemical signals that trauma has occurred, and these signals draw the attraction of the immune system, uh, macrophages, um, TNF alpha, interleukin 6, platelet aggregation. All these little tiny things are happening, and they'll happen over and over and over in the lifetime of a human. When this recurs and doesn't heal in a nice completed sense, so you want to heal so that you make it like this over here. If that doesn't happen smoothly and it's inefficient, then there is what we call the calcification is attracted to, so say, cement it down and forever heal up the tissue, and that's how you get these calcifications. So it is a indicator of some degree of chronic inflammation, irritation. You know, you've always heard of smokers. If they smoke, you get that those chemicals in the cigarettes, and the stickiness. It'll mess up the ciliary action of the cells to bring up phlegm and so forth. And that chronic trauma inflammation is what they believe is associated with leading to so much trigger to repair. It goes haywire after it never ends, and then you get lung cancer. So the same thing can happen anywhere in the body where there's chronic use and inflammation, and the body attempting to repair itself. It will calcify itself down, you know, along your spine or at your hip joints or at your fingers or major areas of two articulating joints. There's micro trauma all the time. And with that micro trauma occurring, and when I'm going to go to the gym after this, I'm going to be using my muscles and lifting weights, and I'm going to create little tiny micro tears. So I have to have a healthy body with good circulation, well hydrated, with good enzymes to clear away the debris so the repair can happen efficiently and effectively. If I don't have enzymes, which we lose with age, if I don't drink enough water, if I clog up all my capillaries with sticky, sugary, late night eating dinners and sticky snacks high in fruit, sugars, and so forth, then the capillaries can't bring the repair material in. And so that place becomes ineffectively healed. But if I do all these things and my muscles repair beautifully, like when you're a younger child, a youth, there's less likelihood of there being a problem with getting the capillary flow and the repair material there. Although we are seeing young people today getting more and more age-related diseases, even to the effect that we have non-alcoholic fatty liver disease from the junk food gummies we feed them as toddlers, all the sodas and orange juices, all the way up to junior high. They're already getting fibrous damage to the liver and hard livers that can't work anymore. And we have to give liver transplants to these kids, and we're making them obese and diabetic. But back to the issue here is that these calcifications wouldn't occur in the young person if we had a healthy diet. And as we get older, just with use, we're going to get trauma. And if we stay as healthy as we can with water and low carb and exercise and avoiding food allergies and these forever chemicals, and I do the EDTA chelation to promote the microcirculation. And then, of course, I do the exercise to maintain the muscle mass and strength. And I never eat late, so I have a very good prolonged evening of sleep where I can restore my body's use. And these things will work out to the better. Um, I had microcalcifications in my breast with my very first mammogram. I think I was around 39 years old. And I didn't do anything about it. I knew I was going to get chelation done. So I got the chelation done. Uh, by age 58, I had the second and my last mammogram of my entire life. And at that time, there were no calcifications there. So I got rid of mine just by trying to live this lifestyle I'm teaching and doing my EDTA chelation. Hopefully that helps you, Alec. And then Beagle Mom says, "Hi, Dr. E. Hi, back to you. Asked my doctor for hormone replacement therapy. He didn't think it was beneficial at my age. I had a hysterectomy. I'm 72 and very active. Is it too late? Of course, it's not too late. Also, what is a good supplement for tinnitus and osteopenia?" Well, those are I would say regarding osteopenia, hormone replacement is my first choice with vitamin D, along with weight lifting exercises, and taking vitamin D with K2, along with systemic enzymes. So if you start natural hormones, I never give it unless the woman will agree to take enzymes, because young girls are full of enzymes. So I take systemic enzymes every morning to be the little Pac-Man that chew up the debris and older cells in my body, so they clear out, and then I can get rebirth and rebuilding of my tissues and stay healthier and longer functionally on the earth. There's no age limit whatsoever. I have started women in their 80s and their 90s. So it's going to help your bones. Estradiol and progesterone help the osteoblasts that are bone building cells. So yes, I would definitely consider doing that. Now, regarding the tinnitus, so that'll help the osteopenia. Ear ringing, if you take EDTA chelation, the microcirculation throughout your whole brain, brainstem, and the ear and the nerves, there is associated with a reduction in ear ringing. I've seen it over and over again. I don't know if I've ever seen published studies, but my clinical experience is I've seen this with better microcirculation to the brainstem, the brain, the head, and the whole body through chelation. So whether you have a gangrenous toe or you have tinnitus up in your ear, if you have better circulation, everything's going to get better. So that's what I would do. That's not a supplement. You have to go to the doctor and get a IV chelation therapy. The next one is from @Chen 8357. Hi, Dr. E. What are your thoughts on nanokinase? It's all very good. Those are systemic enzymes that function. We use in our product serapeptidase and bromelain and papain and these kind of enzymes. There are papers showing it can dissolve blood clots. Well, there's also papers showing that with serapeptidase, and it's very true. And that is the exact reason I've been taking it ever since I went on hormones in my mid-40s. Also, the Watchman is a left atrial appendage blocker to prevent clots in a AFib patients. Thanks. Yeah. Well, wonderful. Let's see. I was hoping to find your thoughts on the micro impact platform Juvent that I mentioned that week. Thanks. Your thoughts on the micro implant platform Juvent that I mentioned last week. I don't recall that. I'm going to have to take that note down. I'm sorry, Beth, I didn't get that. So I'm going to write in here, what is this micro impact platform? Juvent, Juvent. And I'll look that up. Then the next question is integrative. Uh, I don't know how to say the rest of the name. Just thinking about things to do to kind of help the process between surgeries and aftercare. Well, one of the most stimulating things for growth hormone is to do a fast. To do a fast and to exercise your muscles. So if you're able between surgeries to, do arm exercises or, abdominal crunches, um, if you can use, a stationary bicycle, if you can fast, for 24, 48, 72 hours, a water fast, um, these would be very stimulating for human growth hormone. Uh, I don't take systemic enzymes about 4 or 5 days before a surgery because it is a natural blood thinner. But the post surgical day, after you've had the surgery, the next day, if you're fasting and don't eat, and you take systemic enzymes twice a day, more like five of the ones we use, we have Vitalzyme, and then we have uh, systemic enzyme is the other one, and then we have Vascuzyme. I think we also have Proteozyme. And I would use 4 or 5 of them twice a day in between surgeries, but stop 4 days at least before a surgery. Then you can reuse it afterwards at, twice a day, because it'll clear away the debris of the damage of the cutting and the slicing, and it'll facilitate a faster repair, and it will facilitate a reduction in the pain. So that's what I would certainly do. I would be on a very good multi-mineral, a Albion amino acid chelated mineral. I would be on a methylated B complex because these are the cofactors needed for helping to make tissue. I would be taking the extra vitamin C orally, a buffered vitamin C capsule. I would take at least 1.5, 2 grams in the morning and evening. And I would drink half my weight in pounds as ounces every day to facilitate the cleaning out of the debris from the surgery and the uh, blood clots and the inflammation, damaged tissue. And I would take vitamin D. I would make sure I'm at least on 10,000 international units with vitamin K2. And that would be my bare minimum for help the process between surgeries and aftercare. And then integrative uh, remedies, or whatever that name is. I think you might have missed the first part of my question. All right, let's see what it was. Hey doc, last week I asked you about right ventricle hypoplastic or tricuspid atresia in the heart. My son has that he has to go through various surgeries. Just thinking about things to do that kind of help. Hypoplastic means it's underdeveloped. So there's some degree of apparent right ventricular and the tricuspid atresia means failure to form a good tricuspid valve there in the heart, and he has to go through some surgeries for that. Well, a high protein diet and in between surgeries, the enzymes, the extra D and the minerals and the methylated B complex would be very important. The zinc is in the multi-mineral that I would give him. I don't know how old he is. If he's a child, you could probably use 1/3 of the adult dose and mix it in food. That would be a way that I would begin to do that. He's an infant, she said. All right. So the same thing there. You could take 1 capsule of the multi mineral that has the zinc and the magnesium and the calcium and the potassium and the trace minerals, and just mix half a capsule into some of his uh, food that you're giving him. And then regarding the systemic enzymes, in between surgeries, I don't know if there's any liquid form of systemic enzymes, and I wouldn't certainly fast a child 2 or 3 days, but maybe he could be in a feeding window where he would get his breakfast, and then if he's mostly on liquids and stuff, I think he would empty his stomach rapidly. So you could give him some systemic enzymes in between meals, say 2 hours after a feeding, and maybe one a day would be sufficient to enhance the enzyme support. Vitamin D, 1,000 international units is what I would typically recommend for an infant. And then I think that would be the direction I would go in that arena. I certainly trust that everything will go well, but we'll talk that through with your pediatrician before you give them anything supplementally, because I don't know any of the other side issues that may or may not be going on, where his liver enzymes are at and such. But that'd be the direction we've gone through with children throughout the years that we have practiced. We have mixed it into their food, and we've started things like Juice Plus as early as 6 months. So breastfeeding, of course, is the best, and we'll see how that looks. The other issue is when they do heart surgery, very often they may or may not use anticoagulant medications on the child. So you need to be very transparent with your pediatrician and the surgical team about what you are and are not using. And but those would be the directions I would head. Alex says the orthodigestive enzyme upset my stomach at times. Is there a different enzyme I can try or a certain way to take them? I take 1 or 2 after I eat. Then maybe not stacking it on the top pile of your food mass. Maybe the best thing to do is just to take 1 in the middle of your eating at that time, may be the best direction to go to. We have what is the name of it? Digestive enzyme, and there is a second enzyme there. I forget the name of it, Alec. So ask them at the front office what the other one is. Spectrazyme. Yeah, I think that's what it is, Spectrazyme. And you could try that one as well. Also, you could try apple cider vinegar, a tablespoon with your meal. That may be another direction to go. Let me get another question here. Julie says, what is your opinion of testing and treating for lipoprotein little a, LP little a? What is my opinion of testing and treating for lipoprotein little a? Well, the world of heart disease, which is our number one killer, has certainly not had any impressive breakthroughs or reduction in the cause of death for all these many half century, 5 decades. And the direction of the research was pushed. I don't know whether it was known by the vast majority of people, but certainly it's probably known by a few of the intimate designers who design studies and design what will get published, and who the backers of pharmaceutical products that will support the trend that research is going. This always skews research and corrupts true healing, because there was an effort to push the blame on heart disease to cholesterol as the cause, a saturated fat, and to ignore all the research that was being shared that it was from sugar, white sugar. Dr. Yudkin wrote the book in the 1950s called Pure, White, and Deadly. And his work and what he wrote in that book, Professor Yudkin, will stand up to any research even today. And all that he has said in there was not only confirmed and amplified in its accuracy, but he was right. So how is it that the government can declare, the U.S. Congress can hold congressional meetings by Senator McGowan to find the cause of heart disease, our terrible killer, number one killer, as if congressmen and lawyers have the ability to discern. And what apparently happened was Senator McGowan's staff had a vegetarian lawyer as part of his team who was either accepting publications. I don't know if they were bribed or if that particular congressional staffer lawyer made money off of this. I don't even know if there's alive still today because that was in the 1970s. But the fact out was discovered that they suppressed the research on sugar, carbohydrates, and the inflammation that it caused and the damage to the blood vessels, and the actual research that showed cholesterol from butter or from eating meat was very necessary in repairing the fatty phospholipid bimembrane of the cells, and every cell has to have it. Cholesterol has to be in it, and these phospholipids and proteins have to be in it. And it was suppressed. And so we know the professors that were sending the material. My dad was involved in food research then. Dr. Enig, E-N-I-G, I think she was from Princeton. She was even warned she would not get any further grants to do studies if she didn't toe the line and shut up and just agree that cholesterol and saturated fats are the government declared cause of heart disease since the Senator McGowan's congressional studies on it in the late 70s, early 80s. So you see, people, if you don't do your self-responsibility in your own research, reading books, staying open-minded, you will have money whitewash the pathway you're going to go down. And you won't even probably know you're being pushed down that road. So we have to have a free people. We have to have an informed people. We have to have a people body populace that really loves humanity and wants the best for humanity, which we really see in people who acknowledge the Christian ethos that every man is made in the image of God. And you're supposed to love your neighbor as yourself, and you're even supposed to love your enemy and do good unto them, even though they despitefully use you. That's the kind of character, if you fear God first and that he's watching everything you say and do in your life, then that's the kind of individual you want looking over your body, your lab reports, doing your surgery for you, trying to think of you as important and a child of the Almighty God. But if you're just a product of a marketing system that we can make money and sales off of you, then you can market anything. And I'm seeing this happen to the integrative medicine, functional medicine. It's becoming a joke. Everyone now is an expert in nutrition, functional medicine. Everyone is selling something and making statements like on the internet, you can cure diabetes. I was listening to someone saying diabetes was cured with, what was that internet commercial on? some kind of a honey and a biblical drink or something. So they'll prey on your faith, they'll prey on your um, fears of losing a loved one. It's just really sad to see how it's all happening today. So I pray that the people who are sharing nutrients and medical devices and lifestyle and dietary advice stay strong in their work and their research to share the right things, because there is so much corruption and confusion now. But I'm still glad that there's much more information, because we need an informed people. And there are good resources out there. But there aren't miracle cures. There isn't just a supplement that changes things. You have to get up off of the couch and you have to exercise. There's just no way around it. 3 times a week with weight training, number one, and aerobic activities, at least on the alternating days, like a brisk walk or bicycling, that kind of stuff as well. And not baby weights. I'm talking about real machine weightlifting in the gym, and doing that. If you're not a professional, I would stay with the machines where you're more safe and doing it under the guidance of the controlled environment of using machines. You have to change your lifestyle of your eating. You have to get away from this synthetic kind of processing and packaging and refining of foods. We have thousands of chemicals that are being put into our foods in the form of dyes and colorings and taste enhancers and preservatives and emulsifiers. These drugs are just foreign to us. So you have to take responsibility for yourself and choose to eat real food, a real grass-fed piece of meat, a real wild-caught piece of fish, a real prairie-raised chicken and their eggs, real garden in healthy, farm land that has, the manure of the cattle tilled into it and turned over and rotated. So eating real food, not the packaged stuff. Trying to have raw dairy products. Limit your time of eating. The older you get, you have to help yourself with digestive enzymes. If you're a blood type A, you probably need that sooner in your life. You have to get exposure to the sunshine. You have to drink enough water. You have to discipline yourself to shut the lights off, turn the phone off, close the laptop computer, and when it gets dark, darken the room and go to sleep. And that will help you if you arise with the sunshine and ground yourself and let the infrared get to you and in your eyes in the morning with sunrise, standing in the grass grounded. The earth and the electronegative energy from the earth will come through your bare feet. The infrared light will get through your skull and your skin and clothes. You'll be like a recharged battery. And then be very cautious about the amount of fruit sugars and starch carbohydrates you eat. We are composed, I always pinch my cheek, we are composed of protein and fat structurally. We really have no essential declaration of carbohydrates as a nutritional essential material. Only fats and proteins are considered essential. And of the carbohydrates that we do have and that we eat, they do have nutrients and micronutrients in them that we can use, but you can get them also from the fish and the meat and the egg yolks and so forth. So these are the things you have to bear in mind as you're living your life and running through that. Lipoprotein little a, there's a whole video series on this. Actually, there's 2 in particular. one on lipoprotein little a is pointing out that vitamin C supplementation will really resolve the uh, any potential risk of having a high lipoprotein little a. And the argument there is that lipoprotein little a is acting like a procoagulant because we don't make vitamin C. All the animals do make vitamin C, and vitamin C helps us to prevent bleeding gums and poor tissue healing and getting, this kind of scurvy, uh, breaking down of the tissues and leaking blood at microtrauma. Well, lipoprotein little a is acting very much like a vitamin C. We find that if you take vitamin C somewhere in the neighborhood of 1.5 or 2 grams morning and evening, it will have the effect of no risk for any of the potential theorized cardiovascular risk of lipoprotein little a. I have elevated lipoprotein little a, and I have no fear and no cardiovascular disease because I always have been taking vitamin C, and that's why we put it in the IV of chelation along with the minerals and the B vitamins to facilitate wound repair, blood vessel repair, and that's why the cardiovascular system is so healthy in those who do EDTA chelation therapy. And we have saved limbs, gangrenous feet and ankles, toes, stopping them from having their amputations. We have literally achieved that with chelation, with the vitamin C, the B vitamins, and the minerals that we put in there. So lipoprotein little a, I really don't test for it because I give vitamin C and all the nutraceutical advice. It's in the Juice Plus. It's in the multi-mineral vitamin that we give called Energy Core. It's in the IV solution. So it's in a healthier diet. So that's why I don't really order lipoprotein little a. Some of these fancy cardiovascular panels, NMR panel is looking at the LDL subfractions for big fluffy LDL and smaller dense LDL particles. The more small the LDL is, the higher the number, the worse the prediction for heart disease. But that always, always, always correlates with a higher blood sugar, and it always correlates with higher triglyceride levels and lower HDL cholesterol. That's why if you focus, like we've been teaching for decades, getting your glucose down into the 80s fasted and keeping your triglycerides double digit or less, not down to, I would say 50, 75 range on triglycerides, and keeping your HDL up, that will go up with exercise and a low carb diet. That itself is a solution for cardiovascular disease, dementia, diabetes, the promotion of cancerous changes in your body, just by a commitment to exercise, not eating late, a low carb diet, doing those things. So I think it's well worth your while. You can hit basically all of the major killers: diabetes, dementia, cancer, and heart disease. With that, just that lifestyle, I think that's why we do so very, very well here as a clinic. Alrighty. So I have no more email questions, and I'm wondering if there are any more live questions. I think we've answered them all. You're becoming so educated, and we are taking such good care of ourselves. So I think that unless you have more questions here, I'll probably wrap up a little bit early, 10 minutes early today, and bring this to a close. And of course, always, if there's anybody who is blessed with this, if you like and subscribe, share this with a friend. We don't monetize this. but we just make it as a weekly way for our patients to get some feedback and connect with us and ask their questions. So until then, I think what we'll do is we'll say good night, and I'll see you next Tuesday, 6 o'clock here. So I'll say God bless, good night.